welcome to First Aid for Families. Oh, am I going right yet? Hang on. Oh, I don't know what's going on. Bear with me. Good evening and welcome to First Aid for Families. I'm Sarah and I hope you are all well. Sorry, a little bit delayed starting. We've got this new live producer for Facebook Lives and I don't know how it works. So bear with me. Hopefully I'm looking in the right direction and hopefully you're picking up my voice. I can't see the chats at the moment. Let's have a look. Where are they? Yep, I can see them. Hi Alex. You alright? Okay. Right, I think we're all sorted out. So Alex, you hear me? Good. Right. Okay, how's everyone been today? It's a bit of a shame about the rain. Good old British way. Let's talk about the weather first of all. But no, it's been a nice day out of the sunshine and into the shade a little bit. So at least we don't have to worry about heat exhaustion or heat stroke like we did have to talk about and potentially have to deal with last week. So Laura's here. Hay fever. We will talk about hay fever, Laura, another time. But today we're going to talk a little bit about shock. But thank you for joining. Katie there as well. Troublesome twosome there, I reckon. Okay, so does anyone know what shock is? And I'm not talking about someone sticking their finger in an electric socket. I'm not talking about someone jumping out from behind a bush at you, but I'm talking about shock that's associated with an illness or an injury. Does anyone know what shock is and why it's so important we deal with shock? Just looking for my comments. All right. Now, shock, it is a life-threatening condition, so it can't be underestimated. And the level of shock will actually depend on the severity of the injury or the illness. Now, shock, it's basically, if it is left untreated, it can lead to death. So that's how severe shock can actually be. And actually, even a minor injury, a nondescript injury where there is potential blood loss, if it is left untreated over a period of time, that person can deteriorate quite quickly. So again, important we deal with it. We see many cases of people walking away from car accidents, train crashes and things like that. They walk away thinking they're absolutely fine, but then they're found, 100 yards down the road by the side of the road unconscious because their injuries have actually caused them to go into shock. So it really needs to be dealt with quickly. Now, shock occurs when the circulatory system, which is basically a disruption to the oxygen to your body, the circulatory system will actually deliver blood and oxygen to the tissues and it removes any waste products. So when that starts to fail, then you're not going to get the oxygen to the heart and to the brain, and therefore it becomes deprived. And we'll talk about the symptoms of what that actually looks like as we go on. Shock can even be compounded a little bit further by fear and also pain. Now, the common cause of shock is blood loss. You might hear it being called hypovolaemic shock. It's when you lose around 20% of your blood or bodily fluids. So that's around 2 pints or 1.2 litres of blood. So that's quite a lot, but it can happen quite quickly, and it doesn't always have to be that amount to see signs of shock. So it might not always be external. So if there's internal bleeding, so you've got closed fracture or something like that, then again, internal bleeding, that you're still losing blood out of the circulatory system. It's going into other areas of the body which you shouldn't really be going into. So therefore, the body is going to react. Therefore, the heart and the brain, again, are reduced in oxygen again. So again, shock can develop that way. Other ways, vomiting, diarrhea, so loss of other bodily fluids, and also serious burns as well. especially when you've got blisters and things. Blisters are formed over wounds to protect the wound and also to start cooling it down as well. So again, the fluid is going to that point and it's not actually being utilized correctly within the body. All right, so there are a few examples there. There's lots of other types of shock that we hear about, but we're just going to think about this one at the moment. So you've got septic shock, anaphylactic shock, okay, and you've also got neurogenic shock as well, which is damage to the spinal cord. We're going to talk about septic shock in another live, I think, at some point, but just for today, we'll stick to the hypovolemic shock here. Now, can anyone or has anyone had any experience of someone going into shock in front of them, or they've gone into shock themselves, and what that actually looked like and what that person was doing? Let's have a look on the comments here. No? Let's have a look. Sorry, my comments are really quite slow coming up today. Let's have a look. Right. No? Okay, right, so recognition of shock. So a rapid pulse. So if you can find someone's pulse, whether that's in the neck or in the wrist there. Pale, cold, clammy skin. They will be sweating as well, but a cold, clammy skin is quite a sticky feel, and it's a cold sweat. All right, so it's not a nice feel to them. Now, as shock develops, a rapid shallow breathing. So again, they're going to have problems with their breathing. Remember, we're losing oxygenated blood potentially to the brain at this point and also to the heart. A weak thready pulse, so when the pulse starts disappearing, and if it actually starts disappearing from the wrist, it's one of a good indicator that half of the blood volume will be lost. So again, that's quite a serious aspect there. You'll also see cyanosis, which is a grey-blue bluing around the lips. It can be on the lobes as well, so your earlobes, and also on the fingers. So if you start pushing down on the finger and the blood doesn't seem to release back into it, again, that's another sign that that person is in shock. Weakness and dizziness, so they might not be able to stand up. Okay, so we'll talk about what to do with that casualty in a minute. Nausea and possible vomiting. So if that face goes green, what are we going to do? Get out of the way because they're probably going to be sick. All right. They're also going to be thirsty. All right. And we're not going to give them anything to drink or eat at this point in time. That's a big no-no, especially with someone that's potentially needing medical care. What you can do is moisten the lips. So just put a bit of water around the lip area there, and again, they'll get a little bit of hydration from that. Reason we don't give them water or food, it could induce vomiting, as well as they might need surgical care later on, depends on the severity of the injury or the illness. Now, as the oxygen supply depletes in the brain, so we're getting to really a serious stage now of what we're doing, shock. I feel like I'm in shock. You might get restlessness and aggressiveness. So that person that was quite calm starts to get quite aggressive. They want to get up, want to get moving around. Okay, that's quite a key aspect that shock has really gone on too long here. Aggressiveness. They don't have to be drunk people to be aggressive when it comes to shock. It could be anybody dealing with shock can get quite aggressive. Yawning and gasping for air, again, trying to get that oxygen into the body. And then quite quickly afterwards, you might find unresponsiveness. So that person actually loses consciousness. And then if that is allowed to continue, the heart will stop. So it's really, really important that we recognize that the signs and symptoms of shock and actually deal with it. Because once that heart stops, there's only one thing that we can actually do, and that's going into CPR. Okay, so cardiopulmonary resuscitation with rescue breaths. All right, and again, we're going to talk about CPR on another live. How's everyone doing? All right? Good. Right. So, what do we do? What are we going to do if we see somebody or we suspect someone has shock? What do you reckon the first thing we need to do is, let's see if everyone's brave enough. Right, what we're going to do is to help that casualty to the ground, okay? And we're going to lie them on the ground if we can. And at that point, we can then deal with their injuries. So if it's a severe bleed or it's a burn, then we can deal with that. Because once we start dealing with the injury or the illness, then again, we can start treating shock. So deal with the injury. Um, get that person onto the ground, and remember, we want to get them onto the ground almost straight away, because we talked about people getting weak and a bit dizzy. Again, we don't want them to fall down. It's going to cause further problems to that casualty. Help them to lie down if you can. So if we're outside, put something underneath them to protect them from the cold floor, all right, a rug or a blanket or something like that. And then what we need to do is to elevate the legs. You don't need to bring their legs too high up, but what we want to do is bring them up enough to be above the level of the heart. Okay, so elevation of the legs there. What that does then is gets all the blood into the core, into the vital organs there, and that's where we need the blood, and obviously back to the head. Call 999 or 112. Ask for emergency help and tell them that you suspect shock. Loosen off any tight clothing, reduce constrictions at the neck, chest, the waist. So if they've got ties on or belts or anything, then just loosen off that clothing. You don't have to strip them off at this point. Okay, people might ask questions about that, but just reduce their constrictions around the body. Keep the casualty warm. Again, cover them up with a blanket or something, some clothing over their legs and over their body there. Um, when we want to keep them warm, we just want to keep them comfortable. What we don't want to do is actually give them a hot water bottle or give them, I don't know, a heater or anything else like that. Because if we give that person, let's say, a hot water bottle, they have it on them, all that blood will just rush to that hot area. And what we need that blood to be doing is circulating correctly around the body. So keep them warm, but don't use direct heat onto that casualty. Monitor, record vital signs, and wait for help to arrive. So if they seriously deteriorate and they're getting worse, it might take a call back to the emergency services just to say, that the casualty is getting worse. They are now unconscious, let's say. They will then know that you are at a higher priority, and hopefully they'll get to you a little bit quicker. But stay with them, and as I said, monitor and record vital signs and wait for help. Right, what we don't do, as I said before, is allow them to eat or drink or smoking. We see it in the movies, but it's definitely a no-no. One, smoking is bad for you anyway, and two, it depletes the oxygen quicker. All right. Don't leave the casualty unless you have to. Unless you're on your own and you have to ring the emergency services, don't leave them. Don't move them unnecessarily. Keep them where they are unless they're in danger. Remember, we talked about Dr. ABC, I think it was last week. So if they are in danger, obviously move them. If they're not, then leave them where they are. Don't warm the casualty with hot water bottles or any other type of heat source, as I said before. And this is quite a key one here, is do not lie a pregnant casualty, so a pregnant woman, down on their right hand side. Most casualties we're treating with shock, we'd lie them on their backs, okay? Anyone that's been pregnant or is married to anyone that's been pregnant and things like that will probably remember from the midwives and maternity staff saying, don't lie on your back and don't lie on your right hand side. The reason we lie them on their left hand side or slightly incline them to the left hand side, so raise their right hip, okay, is so that the blood supply can still reach back to the brain. Because on the right hand side, you've got the vena cava artery, and if there's a lot of pressure on that, that will stop oxygenated blood to mother and baby, and it can be fatal. So it's really important to make sure that we put a pregnant woman onto their left side or as close to their left side as possible. As I said before, stick a jumper, a coat or something under the right hip just to roll it over to the left hand side. So that is basically what we need to do when we deal with shock. And as I said, it is really important to recognise shock. And what I do when I teach first aid is I say, if there is an injury or an illness, let's suspect shock. So always have that in your mind and treat that person. All right. And don't let people wander away from accidents as well. Keep an eye on them for a period of time just to make sure that they are okay. Now, I've been rambling on for 15 minutes. My goodness me. Sorry about that. Has anyone got anything they want to ask me? Laura, I would love to talk about hay fever, but I hope you're staying fit and healthy. Keep the Puritan going, I suppose. Hopefully this wet weather has reduced your hay fever slightly. I'm just going to pick on Laura now. She keeps asking me these questions. Anything you'd like to ask? I'll leave it for a couple of seconds because I think there's a bit of a delay. Recovery. Oh, here we go. I can see some comments coming in. Legs in the air. Yeah, elevation of the legs. So only a slight elevation on the legs there. What do you do? Very bad. I'm just reading here, sorry. Katie, what do you do if it is you? If you go into shock and you start passing out? Is that what you're asking me? So if you're in a position that you're not feeling very well, then sit yourself on the ground and elevate your legs. And if you can deal with the problem, so if you've got bad diarrhea, you just want me to say diarrhea, don't you, on Facebook here? If you've got diarrhea, then obviously get some liquids into yourself. And if you are really worried, then get hold of the doctor as soon as possible. But if you think that you're going to be losing consciousness, then ring the emergency services straight away. Okay, and hopefully they can assist you. Any other questions there? A bit of a new setup with Facebook. Okay. Right. Well, if you haven't got any other questions, oh, I see, Katie. It's for Laura. Okay, I get you. So an ongoing problem, is it? All right. Thank you so much, you guys, for joining me. And I look forward to speaking to you guys soon. And if you have any other questions, then drop them in the comments and I will get back to you as soon as I can. Take care.